that wall between home health and in-home care. Many of our clients have this impenetrable wall in their offices. Home health sits on this side and in-home care sits on this side, and never the two shall meet. We often see this when we engage in an agency to help them transfer patients from in-home care to home care and reciprocate home health to in-home care, because we know that the patient is best served through that total patient care model. We know that. We know that Medicare certified home health is going to be intermittent skilled care, and there's still going to be needs that an in-home care provider can provide. The best way that we can share with you to do that is that you need to communicate. You need to walk through some of the patient types that you are going to be able to serve. Ask them about the challenges that they are seeing in some of their tough clients, some of their tough patients, to see if you can serve them on the in-home care side. The best thing that I can tell you to do is that you got to bridge that gap and build that bridge between yourself in-home care and your Medicare certified home health friends. Together, you're going to be able to serve that patient better. And you know that. So just get with your home health marketer and start building that bridge together.